everybody. Welcome to Cornell. We're really excited to have you here.
My name is Susana Morales. I am a primary care doctor and the director and principal investigator for our new Diversity Center of Excellence.
So today's program is just one of the prongs of a multi-pronged approach to trying to change the complexion and the composition of our healthcare workforce. Today specifically was addressing pre-medical students and their needs and the knowledge gap that they often have when they don't have somebody in their family who is a doctor.
Fortunately, I got into a research laboratory and I got hooked, and then I really found, kind of my passion and my fit.
I was honored to run a workshop where we had an opportunity to interact with some of the students, and it was really rewarding to kind of see their passion, and they actually really empowered us.
We know that there are a lot of young people who are very interested in going into medicine, but they fall off the tracks somewhere along the line. And the Diversity Center of Excellence is really specifically designed to overcome some of those barriers. The Diversity Center of Excellence is the education core in the Cornell Center for Health Equity.
When I think about health equity, I really think about how does the medical profession treat and serve the diversity of our population.
Health equity means everyone, to my mind, deserve the highest level of care that's available in our society.
My role in the Center for Health Equity is to help students and young investigators into careers that involve research addressing these problems.
It is known that minority students are more likely than non-minorities to practice in underserved or impoverished areas.
And that's not to say that you can't connect with someone who doesn't necessarily look like you or speak like you or act like you, but that is just our general way of connecting.
Cultivating the group of people that is supposed to be teaching you there and talking to
This is Dr. Morales' brainchild called Mentoring Cascades. The trainees get to see people who are very well established in their career, but they also get to see people who are a little bit closer to them, so maybe just a step ahead of them.
So we're all in a safe space. It just comes from the comfort of you being able to sit at a table with people who look like you.
In order to achieve it, you have to see it.
We need diverse students to really train the next generations of doctors, and the faculty needs to be as diverse to meet the demands of our society and our culture.
For me, being a Latino in medicine, being first generation Cuban, first generation college graduate and physician, it was very difficult actually to go through that process. I think that's precisely why the mentoring cascade, where we have all levels of trainees kind of coming together and being able to actually talk about what are those challenges that everyone's not only going through but overcoming.
It's a warm community. No matter where I've been in my career, Weill Cornell has always been there for me.
Because it's a pipeline program, we're not only working with them at the college level, we're also working with initiatives at the high school and at the middle school level.
This is all really just more encouragement to really discover yourself, discover your core values, and if medicine is really for you.
And so the ultimate goal to feed more young people into the pipeline and contribute meaningfully to the diversification of the U.S. healthcare workforce.